Toxic adenoma is a rare cause of hyperthyroidism, as you know that mostly it is of the pituitary inner region and external disease. So that's why it is a rare cause of hyperthyroidism. Now, what is toxic adenoma and how it arises? Toxic adenoma, you can say it is a solitary tumor. What happens that in the thyroid gland, when a single nodule, it increases in size, and it suppresses the nearby cells and grows into the tumor. This is known as the toxic adenoma. Now, toxic adenoma, as I told you, that it suppresses the nearby cells, and what happens that the pathology that you can observe is the cells are very near to each other. You can say they are sequestered, and also the epithelial cells are columnar, but they are low columnar as compared to the cells that we observe in hyperthyroidism. They were tall columnar cells, but here in this case, there will be the low columnar cells that can be observed. Now, talking about the clinical features of the toxic adenoma. Now, the patient will obviously suffer from the symptoms that will be much more related to the hyperthyroidism, as there is also increase in the level of the thyroid hormone. But these symptoms begin when the size of the adenoma is 3 centimeter or above 3 centimeter. Then the patient will experience the symptoms related to the different parts of the body, like there will be the gastrointestinal symptoms, there will be neurological symptoms, as we discussed earlier. The major symptoms are because of the necrosis and the hemorrhage that is taking place within the adenoma. Now, as I told you, that it is a giant nodule that grows up and form a adenoma. So in that giant nodule, there will be the necrosis can be there. There can be the hemorrhage that lead to this appearance of the symptoms in the patient, and the patient will present with the symptoms of hyperthyroidism. So these are some prominent features of toxic adenoma. Now, you guys are able to conclude that hyperthyroidism is an excessive production of the thyroid hormone that is due to the Graves' disease, that is due to some intrinsic disease, like we discussed about the toxic multinodular goiter, and then that can be due to some external causes at the end that we discussed about the toxic adenoma. Now, summarizing that, all of these 3 causes basically precipitate in changing the way the thyroid hormone will be produced and released from the thyroid cells. They are either stimulating the increase in production of the cells, or they are causing the hyperplasia that leads to the overproduction or overactivity of the gland. Subsequently, the level of the hormone will increase in the body, that will lead to the or increase in the basal metabolic rate, leading to the symptoms that are related to the hypermetabolic state, like there will be the heat resistance, the tolerance to the heat will decrease, there will be the increase in the sympathetic stimulation leading to the diarrhea, sweating, and there will be the symptoms that are related to the cardiac system and the brain as well. Then we also discuss about the pathological features that can be seen in the patient of hyperthyroidism, and we discuss about the Graves' disease and the rest of the 2 causes of the hyperthyroidism in detail. So you can now completely completely discuss about the hyperthyroidism in detail. So thanks for watching sqadia.com.